Ever wish your mind had a mute button for pain? Well, it's possible with cognitive behavioral therapy. Let's dive into the scientifically backed treatment that can help you control your chronic pain. Stick around and who knows, you might just start feeling better before the end of this video. Chronic pain, it can really mess things up. It gets in the way of work, messes with our relationship, and just generally leaves you feeling sad. But what if you could just tweak your mind to take control of your pain? Well, science says that by changing your thoughts and behaviors, you can actually dial down the pain. And that's where CBT steps in. It's sort of like a volume knob for your pain. Let's talk about a story inspired by real experiences. We're going to call our character Joe, although details have been changed to maintain confidentiality. All right, now picture this. Joe's a construction worker in a bustling city. 5 years ago, tragedy strikes, a scaffold gives way, Joe plunges 3 stories, he's left with broken legs and a really bad back injury. Now, this story is inspired by real world experiences and it's designed to illustrate the struggles that folks with chronic pain can go through. Now, remember, for this story, any similarity to actual persons, living or dead, is purely coincidental. All right, so going back to Joe, his pals call 911 quick and he's off to the ER. He spends 2 weeks in the hospital with doctors warning him he might not be able to walk again. They patch up his spine, stick some rods in his leg, but the pain's rough. 6 months later, Joe's back into the OR for another round of surgery. They fix him up as best they can, but Joe's legs aren't the same and he's got this constant pain. Even after all that, Joe's still dealing with the aftermath. He can't work his old job anymore. He loses a lot of his physical strength and that messes with his head. He's hurting all the time and it's hard on his family and his friends. And that's the thing, chronic pain's a really tough gig. Folks like Joe try all sorts of stuff, physical therapy, medication, surgery, but when the pain doesn't quit, it can really get patients like Joe down. All right, now after 5 long years, Joe's primary care doctor suggests something new, a chat with a pain psychologist and a shot at this thing called cognitive behavioral therapy for chronic pain. He tells Joe it's a therapy that's solid, evidence-based, backed by lots of science and data. And he tells Joe that it gives folks like him an ability to handle their pain better. It teaches them tools that can help them both improve their body and their mind so that they can live bigger, fuller lives. So Joe starts CBT and the pain psychologist and him zero in on his thoughts, feelings, and actions. All the stuff that we know influences pain. It starts by figuring out what are the triggers that set pain off and then digging into some of the negative thoughts that can make pain worse. See, then the psychologist tells Joe that CBT also helps us change the way we act. Now, CBT encourages us to do stuff like taking a little walk around the home, even when the pain's really bad. This might not seem like much, but it's a big step towards moving back in the right direction towards helping you turn down that pain and improve your physical functioning. Now, pain's this tricky thing, right? It gets into every part of your life. So this therapy, CBT, looks at the whole picture and it helps folks manage the ups and downs of their pain. And the research backs it up, right? Evidence-based psychological treatments like CBT have helped patients all over the world better control their pain and improve their functioning. And with this therapy, people like Joe learn new ways to react to pain, and it helps change the way that their brain actually processes and deal with the pain. Now, going back to Joe, after doing the CBT and really practicing the skills he's learning in sessions, he's starting to manage his pain better instead of letting it run the show. Now, at first, Joe wasn't sure about this approach, right? He initially figured he'd stick with just meds, but after 5 years, the medications weren't cutting it. Now he's managing the pain himself and it's actually working. This therapy, CBT, has been a big win for Joe and it's helping him take control of his life and really change his outlook. All right, so how can you get started with CBT for chronic pain if you're somebody who's suffering? Well, the first step is to talk to your doctor or your healthcare provider about it. They can refer you to a pain management clinic or a psychologist who actually specializes in CBT for pain. Also, the American Psychological Association has a directory of psychologists. You can use this online resource to find a specialist in your area. When you would just be sure to check off the box that says pain management as one of the specialties, and you can even look for psychologists who offer virtual appointments that you can do from the comfort of your own home by video. Enjoying the video so far? If so, don't forget to hit the like button, share, and subscribe. But hold up, we're not done wrapping things up just yet. I've got a question for you. Have you ever wondered if you could train your brain to manage your pain differently? I've got some good news. Click on the video over here to learn more about how you can rewire your brain to better handle chronic pain. We're going to take a deep dive into the complex relationship between chronic pain, behaviors, and emotions, offering up some fresh strategies for you to try out. I'll see you in the next video.